Good morning, folks. Ron Ray here with Turning 65 Solutions. This morning, we're going to continue our update series for 2024 for Medicare supplement plans, original Medicare. And today, we are going to cover the high deductible Plan F and high deductible Plan G. Now, these are plans that are similar to the Plan F and the Plan G, except that prior to the plan actually kicking in, you have to meet a deductible out of pocket. So we're going to skip down here in this book. We're working right out of the Medicare publication, Choosing a Medigap Policy. This says 2023. It is now November 3rd of 2023, and we're talking about 2024, but the government won't have the 2024 book out to us until about June. So we're going to work out of this book, but we're going to give you the updates. So we're going to skip down here to page 11, where we've got the little handy-dandy Medicare supplement chart. All of the plans that are available are right here on this chart, A through N. Today we're going to cover the high deductible F, that's the one with the star, and the high deductible G, that's the one with the star. Okay, now, Plan F pays every bit of your share of the Medicare bill. So Medicare pays their share, about 80%. Plan F pays your share, about 20%. With no out-of-pocket, no deductible, no copays, no nothing. Now, if you've got the standard Plan F, not the high deductible, you literally have no out-of-pocket costs for Medicare-approved medical services in hospital or out of hospital. With a high deductible, we add the little star right there, that adds a deductible that you must meet first before your supplement will pay. And in 2023, we can see that deductible is $2,700 in 2023. For 2024, that deductible is going up to $2,800, $2,800. So once you've met that $2,800 deductible, the Plan F kicks in just as if it were a regular Plan F, and you have zero out-of-pocket for Medicare-approved medical services for the rest of the year. And it's based on a calendar year, so from January 1st to December 31st. That doesn't mean you have to pay the full bill. Medicare's still paying their share. Okay, so if you've already met the Medicare Part B deductible next year, $240, then Medicare is going to pay 80% of the bill. So let's assume that you've already paid $240 out of pocket. Then you go to the doctor, and the doctor says you need this MRI scan, and you go and you have the MRI scan, and it costs $1,000. They send that bill to Medicare. Medicare's still going to pay their share, 80%, $800. But because you haven't met your $2,800 deductible yet on your high deductible Plan F, you're going to pay your share, which of course is 20%, about $200. So you're not paying the full bill, you're just paying your share. And then once you've paid your share in total to equal $2,800 for next year, then the Plan F kicks in and you have zero out of pocket. That's the high deductible Plan F. Deductible in 2024, $2,800. Now let's talk about the high deductible Plan G. It works very much the same way. You have to meet next year a $2,800 deductible, covering really just your share of the Medicare bill. Medicare pays their share. You're going to pay your share up until you meet $2,800. And then the high deductible Plan G kicks in and pays the rest. So people ask very often, what's the difference? It sounds like they're the same. They're very much the same. The main difference is that if you went into Medicare after January 1st of 2020, you cannot get a high deductible Plan F. You have to get a high deductible Plan G if you decide you want one. If you went into Medicare before January 1st of 2020, and you have a high deductible Plan F, you can keep it. You don't have to get rid of it or change to a G. You can even get a new one, or if you have some other plan and you're interested in a high deductible Plan F, you can get a new one. As long as you were in Medicare Part A before January 1st of 2020, a Plan F is okay. If you were after that date, Plan G is going to be your choice. Now, what's the difference between a high deductible Plan FG and a standard Plan F and G in terms of premium? The premium is drastically lower. So in our area here in Central Texas, a Plan F for somebody who is turning 65 might run about $120 or $130. A standard Plan F might run $120 or $130. A high deductible Plan F might be only about $45 or $50. Same difference with a Plan G. In our area, a new Plan G for somebody turning 65 might be between about $95 and $115, where a high deductible G would be somewhere between about $35 and $50. So a big difference in premium, as long as you are willing to cover that $2,800 risk. Now, it's just a risk. It's not real unless it happens. So if you only go to the doctor once a year for your checkups and that's about it, it may be a good risk for you to take. Save that premium. So you're going to save roughly about $1,000 to $1,200 a year in premiums. And if you do that for about 2.5 years, well, now you're in the money. Now, if you get sick and something happens and you pay that deductible in the first year, well, now you're losing money. So that's something that we have to weigh. We have to look at what's your health now, what's your current health, your current usage of medical care, how often do you go to the doctor, the hospital, and what's your expectation for the next several years. Now, we can't predict the future. That's why we call it insurance, because we just don't know. We're covering risks. But that's what we do here at Turning 65 Solutions. We help you determine the best path for you to choose. So if you have any questions about this, give us a call. The number is 830-217-6711. Also, look us up on the web at www.t65s.com. We've got a great article about the high deductible plans. I'll put a link in the video description down below. Also, don't forget to give us a thumbs up down below if you enjoyed this video, if you found the information helpful. That helps YouTube get this video out to other people who are seeking the same information that you were today. And don't forget to subscribe to the channel so that you can be notified when we upload a new helpful video. We're going to be continuing this update series here in the next few days and weeks as we get closer to the end of 2023. And we are dead in the middle of the annual enrollment period when you can make changes to Medicare Advantage plans and Medicare prescription drug plans. If you have one of those, today we're talking about supplements. But that's what we're doing, and we're here to help you. If you have any questions at all, give us a call. Until the next video, though, we hope you enjoyed it, and we'll see you. Bye, folks.